back to my channel. For those of you who are already part of my family, thank you so much for being here with me once again today. For those of you who are new, welcome. My name is Kira Selena. I'm a practical nurse, and on my channel we mainly talk about nursing, but we also do a bit of beauty, vlogging, hair, and all kinds of different stuff. So if you're into any of those things, especially if you are starting your nursing journey or if you are already into your nursing journey, make sure you bang on that subscribe button and join the family. And don't forget to turn on your notification bell. That way you'll be notified whenever I post a future video. So in this video, I wanted to talk about the main differences between nursing in a nursing home or in a long-term care facility and nursing in the hospital. I know a lot of people are finishing up nursing school and they're trying to figure out whether they should go in a hospital or whether or not they should go work in a nursing home. Personally, I do not have much nursing experience as a nurse in a hospital. However, I would say at least 65% of my rotations were done in a hospital. I did rehab, I did palliative, I did pre-op, post-op on an ortho or an orthopedic unit. I did GAU, I worked on a GAU or a geriatric assessment unit in the hospital, which was kind of interesting because you're doing geriatrics and working with the elderly, but in a completely different setting. So that was fun. And I don't know if I mentioned rehab, but I did rehab and I also did peds in the hospital. So I have quite a bit of nursing experience in the hospital, and my med-surg rotations were a month and a half each. So I would say I have at least 5 months of working experience in the hospital as a nursing student. And as a nurse, I worked in a hospital for at least 1 month, but I left because the team was horrible. But I did work in a hospital as a CNA for 2 years while I was in nursing school. Other than that, most of my nursing experience as a nurse, like as a licensed nurse, has been in the nursing home. So I've gotten a feel of kind of both, and I feel like I'm well positioned or experienced enough kind of in both worlds to do this video and kind of share this with you. Video, I just want to say this is in my personal experience. I know I'm going to say some things about nursing homes that some nursing home nurses may not agree with because it doesn't apply to the nursing facility that they are in. So before I start this video, I just want to say that I'm not talking about your nursing home. I'm talking about the norm. And in my experience, the things that I want to say, as well as you know, in the experience of other nurses that I know, because I always do my research before I do videos. So in my experience and the experience of the nurses that I know, the things that I'm going to mention in this video apply. Okay, this is in my experience. First thing I'm going to say about the hospitals is that those are the perfect places to go, or that is the perfect place to go if you want to ensure that your nursing skills stay sharp. Why? Well, because you're dealing with different cases every day, right? The thing about long-term care or about nursing homes that people need to understand is that in the hospital, people are usually sicker and they come to the hospital so that they can get better and then get discharged and go home. Whereas the people who are in nursing homes are not necessarily sick. I mean, they have chronic illnesses that they've had for like 20 years. So they are pretty stable in their condition. Nothing really changes with them much. I mean, you might get a prescription for an antibiotic here and there if a person develops a UTI or something, or you might have a fall here and there, but things don't really change. Things are pretty stable in the nursing home, right? So the reason why I say that if you work in the hospital, you will practice your skills more is because the most you really see in a nursing home, you might see somebody with a permanent catheter that needs to be changed. So you may have some catheter practice, you may have somebody who has a peg feeding, and you may have a blood draw to do here and there, but that's not usually the norm, right? People are usually in the nursing home because of loss of autonomy, usually due to some form of dementia, which means that they are unable to live safely at home, or some type of physical disability, usually from a stroke, right? So people become bedridden or people have physical issues because of usually strokes. You never know what you're walking into. You're walking into something different every day. You are seeing different people all the time. I can guarantee you that if you work in a hospital, even if you worked 7 days a week, you would see your days would be different every single day. Whereas if you're working in a long-term care facility, it's the same patient, Mr. Smith, Mrs. Jones, or Mrs. Parker, whoever. I guarantee you that they're most likely going to be there you know, every single time you go into work. It's the same people, the same routine every single day. Whereas in the hospital, it's different. You're seeing different things. You may have a patient with a trach. You may have a patient with a CPNI. You may have a person with an IV. You may have a person with a peg feeding. You may have a person with a catheter. You will have so many blood draws to do. I remember when I was on my surgical rotation, I had blood draws to do, and not only just to do the blood draws, I actually had to log into the computer and I had to see what the results were. So it got to a point where I was seeing, I knew what a regular hemoglobin levels was. I knew all these different things off the top of my head because I was seeing them so much. And once my rotations were done, all of that information kind of left my head because I never had to see it again. And those are really good things to know as a nurse. I don't even know what normal hemoglobin levels are. I'm not even going to lie. Nurses might not know that off the top of their head because usually when you're looking in the computer, it will tell you, you know, a normal hemoglobin level is between this, and then it'll give you that person's reading, right? But you're doing blood draws, you're doing all types of things, and that ensures that your critical thinking skills stay sharp because you are seeing different things every day and you're seeing a lot of new things all the time, which will prompt you to go do some research. You may get a person might get admitted, they might have a disease that you've never heard from before that you're not familiar with, and then you're forced to go do research, and then that kind of keeps you learning, right? Whereas in a nursing home, it's usually high blood pressure, people with history of strokes, people with high cholesterol. You're gonna give a lot of pine drugs, and for those of you who watch my pharmacology video, you guys know what I mean by pine drugs. All your amlodipine, all your metoprolol, all your beta blockers and your high blood pressure medications, you're going to see those a lot. You might see antibiotics for UTIs. You might see a lot of Pantaloc or antacids given, you know, 7 o'clock in the morning. A lot of them are on different types of medications, and that kind of aggravates their stomach. They might get GERD or acid reflux, and so you might give them Pantaloc in the morning. That's pretty much it for the nursing home. The thing about the hospital that I loved so much was that I got to work with the whole entire medical team. I was working with occupational therapists as well as occupational therapist assistants. Same thing for PT or physiotherapists and physiotherapist assistants. I was working with medical students, you know, on my rotation. I was working with doctors and other nurses. So you're working with the entire team, and I learned a lot of things from OT and PT that I was able to implement into my everyday, you know, nursing, staying within my scope of practice, of course. I've had physiotherapists show me amazing transfer techniques that I didn't learn in school that are so much easier than what I learned in school. I had OT teach me a lot. So working with all those people, you get to learn different things, right? Because we're all there for the same reason. We're all there to make sure that the patient gets better and is able to get discharged or is able to safely be placed in a place where they will be safe. But our scope of practice is different, and being able to kind of learn everybody else's scope of practice and learn their techniques and see the way they do things is also like just really good. Another really good thing about working in the hospital is that you have the opportunity to work in so many different sectors, so many different kinds of units, right? So you may get hired on a med-surg floor and you may love med-surg and, you know, work there for a year or two. But if ever you decide that you want to switch things up as you start to build your seniority, you have the opportunity to transfer to other units, right? So you might get tired of med-surg and you might want to go on a cardio unit or a neuro unit, or you might want to go to ICU or, I don't know, emergency or something. But you have the opportunity to actually move around, and there is so much to learn everywhere, right? So you might meet a nurse who worked in cardiology who knows everything under the sun about the heart. And then you might meet another nurse who worked on a neuro floor who knows everything under the sun about the brain, right? These girls, I won't say girls because they're not necessarily girls, but these nurses are both nurses, both went to school. They could both be LPNs or both be RNs or whatever, but they specialize in two different areas. So you will see that if you pull out two different nurses that worked in two completely different areas, they might know a little bit about each other's areas, but like when you work in one place for a long time, you start to learn a lot about it. Do you understand what I mean? You work on a neuro floor, you work on a cardio floor, you take a cardio and a neuro nurse, and you have them question each other about each other's specialty. They might know one or two things, but they might not know as much as each other about their unit. Does that make sense? I hope that makes sense. I hope you guys understand what I'm trying to say. But basically, yes, you do have the opportunity to kind of move around and get experience in different areas, and that's another really good thing about the hospital. Whereas in a nursing home, it's a nursing home. It's long-term care. You're going to be dealing with dementia patients. You will have some dressings to do. Like I said, you might have a catheter to do here and there if a person has a permanent catheter put in. You may have an IV to put in here and there, but usually whenever things start to get too deep or too advanced for a nursing home, the patient will be transferred to a hospital. Why? Well, because nursing homes are not for people who are sick. They're for people who are stable. So once these stable people who do have illnesses, but like I said, these are chronic illnesses that they've had for years, right? So once they start to develop new issues, especially if they are advanced issues, right, that can't just be discussed over the phone with the GP that works there, they will have to be transferred over to a hospital because they are not equipped to care for people like that, right? So that's another thing. There's kind of like a maximum of how sick a person can be in the nursing home, whereas in a hospital there is no maximum. It's like, bring us the worst case scenario and we're gonna deal with it. So that's like the main difference between the hospital and the nursing home. And one last thing that I also forgot to mention is that in a lot of nursing homes, once again, because these people are stable and their conditions aren't really changing very often, you will see that you will not really have a big team. You will have the nursing staff, so the CNAs and the nurses, but you might not see OT, you might not see PT too often. You might see them here and there, but they're not people you see often. I have personally never seen OT or PT in both of the long-term care facilities that I worked at as a nurse, and the doctor comes like once or twice a week because nothing is changing, so there's no reason for them to be there. The only time you'll ever really talk to the doctor, you might have a patient who's really, or a resident who's really agitated, who's hitting on other people, and you might call the doctor and say, hey, this person is really agitated, can I have Ativan 0.5? And the doctor will prescribe it, and then you will fax it over to the pharmacy will bring it over, you will give them their Ativan, they calm down, and everybody's happy. But that's pretty much it when it comes to nursing doctor communication in long-term care facilities. I know some of you guys are probably thinking, well, why are you working in a nursing home if the hospital is so great? And honestly, I have thought of going into the hospital, but and like I said, I did work in a hospital for a month once I was done school, and I did like working in the hospital. It was just that the team wasn't really good, and usually you have either a 60 or 90-day evaluation where you're working kind of with another nurse who's watching you do things and who's evaluating you and telling you what you can do better and things like that. So you have like a 60 or a 90-day period for that before you are like 100% on your own. But even the person who was evaluating me wasn't necessarily the best, and I didn't want to be in a position where I end up making a mistake and something ends up on my license because I'm not getting the proper training that I need, right? And this is the thing that people need to understand. Just because you come out of nursing school, it doesn't mean that you know everything about nursing. So whenever you are hired in a place, you will have an orientation time, you will be working with another nurse who will be training you as well, because everywhere is different. Places do things differently, and that's that. So that's the reason why I personally didn't stay at the hospital, but I am thinking about going back. However, the hospitals, the facilities that I work at right now have no COVID cases, and considering the fact that I live with 4 other family members, I rather stay where I am than go into a hospital and bring anything at home and put my family at risk, especially considering that I do have family members who live with me who are immunocompromised. So that is the reason why I'm not working in the hospital, but trust me, it is something that I've thought about. And I'm also in the Navy, and the plan was for me to be leaving. I was actually supposed to be leaving next week for boot camp, but COVID kind of ruined that for me. So that's that. This helped you guys. I really hope that this answers your question. I hope you enjoyed this video. If you did, please like it and share it. I'm sure there's somebody out there who can benefit from this information. And if you like this video and sticked around, you know, till the end of the video and you're still here and you have not yet subscribed, please do so. Join the fam, hit the subscribe button and turn on your notification bell. And I hope to see all of you in my next video. Stay safe and much love, guys. Bye.